I met Rob about 30 years ago, actually a little bit more than that. We've been married almost 30 years. And I was attracted to his outdoorsmanship. He taught me so much about the outdoors, and I was just fascinated by it because I was a city girl. I just knew from the start that we had a lot in common. He talked about his journey in life, and it seemed to match mine, and I knew that we were meant to be. So when we first learned that Rob had Huntington's disease, it was really overwhelming. I understood what the implications meant. At that time, we had a child with a developmental disability. I was unsure about how I was going to support both of them by myself and get through this. So things really changed for us when I started looking at the course of treatment that was being prescribed for our son William. They talked a lot about possibilities and opportunities for a young child who can't see anything but that for their future. But they weren't talking about that with Rob's life. They were talking about how to prepare for death and legal things that we had to get in place and how awful it was going to be. I don't remember the exact point in time when I put the two pieces together, but I realized that what we were doing with Will, keeping him involved in his community, connected with his friends, and sharing his story, were things that we could do with Rob too, and that would give us the power that we needed to continue to live. Instead of having HD happen to our lives, we were going to have a life that had HD in it. So another benefit of attending the national conference was that we learned about our local support group. It was at the local support group that we first learned about tetrabenazine. They were conducting clinical trials and having success with the reduction in chorea associated with Huntington's disease. I started following it to see when the FDA would approve it. It was approved as Xenazine, and then we went to our neurologist and asked him if this would be a medication that would be helpful for Rob's chorea and help minimize his movement.
There are other serious side effects associated with Xenazine. Please listen to the important safety information available in this video.
Rob's physician felt that it was something that would be worth looking into and trying. He wasn't as familiar with the medication as I was at that time, so he did some research. We then went back and talked to him, and we discussed the black box warning on it and the side effects that can happen when you're taking this drug. After talking to him about what those side effects could be, we felt that it was best to move forward. So once Rob started taking Xenazine, we noticed that his choreic movements lessened, and it allowed us to continue to do the things that we enjoyed doing as a family. Going to a movie, going out to eat, going over to a friend's house to visit. Sharing our story with other families adds meaning to the whole process of living with Huntington's, because you can give back the pieces that you've learned to families that are just starting out. You can gain support and understanding from families that are further along, and together we can all learn and educate our general community about living with this disease and how it doesn't have to mean the end of life.
Xenazine tetrabenazine tablets. Indications and usage. Xenazine is a medicine that is used to treat the involuntary movements, chorea, of Huntington's disease. Xenazine does not cure the cause of the involuntary movements, and it does not treat other symptoms of Huntington's disease, such as problems with thinking or emotions. It is not known whether Xenazine is safe and effective in children. Important safety information. Xenazine can cause serious side effects, including depression, suicidal thoughts, suicidal actions. You should not start taking Xenazine if you are depressed, have untreated depression or depression that is not well controlled by medicine, or have suicidal thoughts. Pay close attention to any changes, especially sudden changes, in mood, behaviors, thoughts, or feelings, or worsening depression. This is especially important when xenazine is started and when the dose is changed. Do not take xenazine if you have liver problems or are taking monoamine oxidase inhibitors or reserpine. Ask your doctor or pharmacist if you are not sure. At least 20 days should pass after stopping reserpine before starting xenazine. Tell your doctor if you are pregnant, breastfeeding, or have breast cancer. Do not start any new medicines while taking xenazine without talking to your doctor first. The need for therapy should be evaluated on an ongoing basis with your doctor. The dose of xenazine should be adjusted slowly over several weeks for a dose that is appropriate for you. Tell your doctor if you stop taking xenazine for more than 5 days. Do not take another dose until you talk to your doctor. If your doctor thinks you need to take more than 50 milligrams of xenazine each day, you will need to have a blood test to see if a higher dose is right for you. Neuroleptic malignant syndrome, NMS, is a potentially fatal side effect reported with xenazine. Call your doctor right away and go to the nearest emergency room if you develop these signs and symptoms that do not have another obvious cause: high fever, stiff muscles, problems thinking, very fast or uneven heartbeat, or increased sweating. Xenazine should be stopped immediately if NMS is diagnosed. Xenazine can also cause other serious side effects, including Parkinsonism, slight shaking, body stiffness, trouble moving or keeping your balance, restlessness, akathisia, trouble swallowing, irregular heartbeat, and dizziness due to blood pressure changes when you change position, orthostatic hypotension. Trouble swallowing may increase the risk of pneumonia. Uncontrolled movements called tardive dyskinesia, TD, may also develop in patients treated with xenazine. It is possible that the TD will not go away. Side effects such as irregular heartbeat, NMS, and Parkinsonism may be increased when using xenazine with other drugs, for example, dopamine antagonists. Sleepiness is a common side effect of xenazine. Do not drive a car or operate dangerous machinery until you know how xenazine affects you. Alcohol and other drugs may increase sleepiness caused by xenazine. Some side effects, such as depression, tiredness, trouble sleeping, sleepiness, Parkinsonism, agitation, and restlessness, akathisia, may be dose-dependent. If the side effects don't stop or lessen, your doctor should consider lowering the dose or stopping your xenazine. The most commonly reported side effects in studies with xenazine were sleepiness, trouble sleeping, depression, tiredness, anxiety, restlessness, agitation, and nausea. For more information, please see the full prescribing information, including boxed warning, the medication guide, or go to www.xenazineusa.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.